Now we're just going to talk a bit about evaluation and why evaluation is important. Because many people, we talk a lot about monitoring and evaluation, but usually when we do that, or we say M&E, usually it means monitoring, and evaluation is often disregarded. And this comes through quite clearly in many of the VNRs. When you read the VNRs, many of them are not really explaining why performance is not as good as it should be, and not necessarily coming up with what could be done differently, which is where evaluations are very helpful. So the United Nations Evaluation Group has a long definition here, but I'm just putting a summary, which is the evaluations use a criteria to systematically assess an intervention, or it can be an organization, to analyze and explain the achievement of results, both expected results and unexpected results, and to provide recommendations and lessons for decision making. So if you want to explain and say, what do we need to do differently, evaluations are very important. So monitoring typically uses administrative data and statistics, and it tracks progress against the SDGs. So monitoring data can show trends and performance in different policy areas. It can show which targets are being reached or not. It can show where there's underperformance, but it cannot explain why. So in order us to understand why, whether plans, policies, or programs are resulting in their intended results, outcomes, and impacts, and the reasons for why they are or why they're not, we need to carry out evaluations. And evaluations involve a deep analysis of issues such as causality, relevance, effectiveness, efficiency, value for money, and sustainability. And this knowledge can be a good way of getting better, richer reporting against the SDGs and in the VNRs. It says in the guide on page 17, without evaluation, there's no rigorous reflection on whether the right things are done in the right ways, what is or is not working, and why. Without this, there's a risk of repeating mistakes, wasting scarce funds, and losing impact on citizens. And all of us, hopefully, are trying to maximize the impact on citizens. And to try and get the best value from the VNRs, it's important to use evaluative evidence. And just to give you some feeling as to what the report from an evaluation might say, this is from an extract from an evaluation of the National School Nutrition Program in South Africa. And so you can see it says, the relevance of the National School Nutrition Program is unquestionable. Government should commit to providing core funding for the National School Nutrition Program. Schools are an effective channel through which to supply children with nutritious meals, etc. Then in the evaluation, they found that learners are for the most part receiving meals daily, but there's room for improvement regarding the composition of the meals, and it gives detail on that. It found that school meals should be served as close as possible to the start of the school day if they're to relieve short-term hunger and boost concentration. Only 18% of schools managed to serve the main meal by 10 a.m., etc. So this is the type of rich information which can help you to really improve your program. And if this is one of the key programs for you, for your National Development Plan and for the Sustainable Development Goals, an evaluation of it will be very, very helpful. If you want to look at how an evaluation of procurement, for example, in Uganda has been used, you can go on to this link. And it also shows you that just doing an evaluation is not enough. You need to try and do a lot of activities to try and make sure that the results from the evaluation or from research are actually used. And in this video, we talk more about that. There are different types of evaluations related to, and there are different ways you can look at how to structure evaluations. But one way that we found in South Africa is very helpful is related to thinking about what questions you might ask around results-based management. So there's the results-based management pyramid: inputs, activities, outputs, outcomes, and impacts. And we've added a design box at the bottom of that. And before you even design a program, you might need to understand the underlying situation and the root causes of the problem you're trying to address. And we call that a diagnostic review or diagnostic evaluation. Then an evaluation will be done of a program or a policy. A program or policy will be designed, hopefully based on that diagnostic review or other situation analysis which has been done. Once it's been designed, you can do a design evaluation to check whether the design of the program and the theory of change which underlie it seem strong. Once the program or policy is being implemented and the inputs are resulting in activities and outputs, and maybe you're beginning to see outcomes, you can do an implementation evaluation to understand what is happening and why. Once the outcomes are being achieved, you can be doing an outcome evaluation to understand whether the intended outcomes are being achieved, whether unintended outcomes are also being achieved, and why. What is the reason for it? And then what can be done differently to make it better? And if you really want to see the impacts at a high level, you may need to do an impact evaluation to try and understand the impacts the program or policy is having and why. And you might want to do an economic evaluation to look at what the cost benefits or cost effectiveness are. These are not necessarily exclusive. So for example, you can have an economic evaluation as part of a diagnostic review. In the diagnostic review, you might look at a number of options for the design of the program, and you might want to do an economic evaluation to consider the cost benefits of the different options. Similarly, if you've done an outcome or an impact evaluation, you might want to do an economic evaluation linked with that. So these may be combined. And then there's also evaluation synthesis, where you synthesize a number of evaluations that have already been done, and the training tomorrow will be talking about that. It's very important that evaluations are credible and of sufficient quality. And for them to be credible and useful, they must be relevant and timely. So having a very good quality evaluation, but that comes 3 years too late, is not helpful. They must be unbiased and inclusive, and they must be able to pass the tests of research validation, because you use essentially research methods, and you need to know that the research that's been done for the evaluation is valid. So it's valid for the particular case you looked at, and if you want to extrapolate from that case to wider statements about what's happening in the country or regionally, that you have sufficient research rigor to be able to do that. There are also tensions between trying to make sure that the evaluation is owned, and the highest ownership may be if the evaluation is conducted internally by the ministry concerned, and the degree of independence and external credibility. And it's likely to be more independent and perhaps more credible if the evaluation is done by external evaluators, and who are probably external to government as well. So for example, when we look at how evaluations have been used in the VNR, or can be used in the VNR, and the Nigerian VNR is a good example, and we would encourage you to look at the Nigerian VNR to see what you can do. So for example, in the Nigerian VNR, evaluations were used to understand why targets are not being met, to identify what systemic blockages need to be addressed, to identify what changes need to be implemented, and how to transform that achievement, who needs to make what changes, and potentially when. And here's an extract from the Nigeria VNR, taking from its report against good health and well-being. And you can see it's saying the public healthcare system is failing the poor primarily because of an inadequate workforce and issues associated with limited coverage from the National Health Insurance Scheme. It comes up with the key lesson is around hygiene and the need to prioritize universal access to clean water. And it identifies key areas for action, which include reinforcement of implementation of the second National Strategic Health Development Plan. To be able to understand why, the because statement, to draw out the lessons and to draw out the areas for action, evaluations are very, very helpful. I'm seeing one question from Carlos. The most common evaluation done by governments, it tend to be implementation evaluations, in fact. What you find is donors often drive other types like impact evaluations, but often when it's governments themselves, they tend to do implementation ones, like Uganda, for example, or Benin. One of the reasons for that is that impact evaluations cost more and they're much more complex to set up. So often with more donor support, that becomes an easier type of evaluation to do. So I wanted to just give you a bit of an understanding of rapid evaluative work. We did run a training on this on the 25th of August, and there is a recording of that training that's available that you should be able to access. And there's also a guideline that we've done on rapid evaluations, which would also be available for you. It's not been translated into Portuguese, but it's available in English and French. And we're doing a training on another form of rapid evaluative work tomorrow, which is the synthesis, where you're working with existing evaluations. And then on the 28th of October, we're going to be doing a training on evaluative workshops. And these methods are all described in the guide. So there's also an annual review model that's also mentioned in the guide, and many donors use that model. They will, DFID, for example, has an annual review, and that's a good way of having an evaluative process also, which doesn't take very long. All of these types of methods are relevant for the 2021 VNR, where time is limited, and you may not be able to do a full implementation evaluation or certainly not an impact evaluation, but you might be able to do a rapid evaluation, and you can do rapid implementation evaluations relatively easily. So if you go to page 33 of the guide, it talks about what are the key questions you might ask for a rapid evaluation. And it says there, this is likely to be a version of an implementation or economic evaluation, or possibly a diagnostic review. You can also do something that looks at outcomes as well, if there are outcomes available. But your data, if you're doing a rapid evaluation, obviously the amount of data you can collect is more limited. The guide also talks about examples of rapid evaluation purpose, and earlier in the guide it talks about different types of evaluation purpose more generally. And this type of evaluation criteria you could be applying in a rapid evaluation include relevance, effectiveness, efficiency, impact, and sustainability. And you could be doing a rapid evaluation prior to designing an intervention, prior to designing a program or a policy, or when a particular crisis or problem emerges that requires a rapid response, where you won't be able to go into as much rigor as if you had much longer to collect data, but you need a rapid response. And I think typically in COVID, that's what's happening. So in South Africa, there are a number of rapid evaluations that have been conducted, and in Benin as well, and in Ghana, because of the COVID situation where people are needing a rapid input. So this is a methodology which is relevant to you, and there is a guideline which is available which can help you. So what are some of the features of rapid evaluations? So first of all, it's relatively intense. It's a focused evaluation which is executed within a much shorter period of time, And that time is typically 1 to 4 months. Typically, I would say 8 to 12 weeks. That's, you know, some rigorous evaluations, longer evaluations can take much longer than that. One of the ways you save time is by having a number of team members. And one opportunity from rapid evaluations is because you don't have to take staff away from their job for, let's say, a year. It's something that you can try and use internal government staff to be part of the evaluation process, because they're only away for maybe 8 weeks or 10 weeks, and not necessarily 100% of the time, but an appreciable proportion of the time. And this therefore means it's also a good method for trying to build capacity in government for doing evaluation. You need to have evaluation skills as well as sector expertise in the people doing the evaluation. Clearly, the budgets are usually smaller. And so also, if you have less money available to do an evaluation, this may give you an option. There's obviously, you need to have some flexibility on design, because there is a trade-off between the rigor in your research, the amount of data you can collect, the number of sample points, etc., and the speed. You obviously cannot collect as much data. You will typically use mixed research methods, both quantitative and qualitative. It's very important to use existing reports, and the more good monitoring reports you've got, the easier this makes this. You'll obviously you will typically do interviews with key informants, but you may have less informants than you would do in a fuller evaluation. Generally, you have fewer data points. And planning, you're trying to deliver this within a very short period of perhaps 4 weeks is really unusual, but maybe 6, 8 weeks to 3 or 4 months. One of the lessons that's emerged, and it comes through, for example, in that video, that link hopefully will show you something about this, is that the whole process of managing the evaluation needs to be less bureaucratic, but it can still be collaborative. So you can do this outsourced, or you can do it with internal staff. And another option that we have in the rapid evaluation guideline, we talk about a facilitated model, where the evaluator is not necessarily doing the evaluation for you, but they're facilitating you doing the evaluation. So you have somebody who has a lot of expertise, but their job is not to do it for you, but to assist you to do it. The focus typically is diagnostic or implementation, and perhaps outcome rather than impact. And the preparatory phase before doing the evaluation, which may involve, for example, setting up a steering committee, making sure the stakeholders are on board, you need to do that quicker. And the post-evaluation phase, where you take the report and get it tabled in the appropriate management fora, etc., that also needs to be speeded up. And we do have an example of a rapid evaluation and the trade-offs, and on the Moodle site that some people who are continuing with this training will access, they will see this example from the Western Cape of a terms of reference. I mentioned that you can also track evaluations that have already been done. And Uganda has done a very nice example of doing what they call an evaluation map, or an existing, a map of the existing research and evaluations. In this case, it was specifically evaluations. And what they did is they did a search through a lot of databases to try and find out where they could find evaluations. And they then categorized these by the SDGs. And then they would take one evaluation and say, it's about economic development, but it's also, what was the mechanism? What was the tool that was used? They were trying to deliver economic development through the use of transport infrastructure. So this was the outcome, and this was the mechanism on this side. And when the circle here is small, there were not many studies. And when the circle is large, as in here, there were many studies. And as you can see this, there were many studies in health and population health and nutrition, and that's typical. There are many evaluations, many research studies that are done in that area. And when you click on the map here, you will see the list of all the studies, and you can click on the list and then go to each study. So an evaluation map is a really valuable tool for you to build on what already exists rather than having to get new studies. So tomorrow in the training tomorrow, we'll talk more about how you actually synthesize, how you find those studies and how you synthesize those studies. So this is from the guide on page 42, and it talks about synthesizing existing evaluations. So it talks about the objective, which is to systematically distill and integrate data from a number of evaluations and other sources of evidence to draw more informed conclusions. It's implemented once there's an initial evidence base of evaluations. The typical steps would be to, first of all, you have to search for the relevant evaluations. And for those people that were part of the initial 3-day training, we did that searching together in the training. And you then, once you've found the evaluations, you need to obtain the reports, or in some cases, it might be papers on the findings rather than an actual report. And you need to then either commission a service provider or undertake a synthesis yourself, drawing out the common findings and lessons from your question, and then develop your recommendations. So the stages that are involved in the synthesis, the systematic searching, and there are repositories in the UN, 3IE, etc. And as I mentioned, Uganda found over 500. You can look at a source which are called systematic reviews, which summarize many evaluations or research studies and summarize the results. And there are places that have examples of those systematic reviews, for example, 3IE website, the Campbell Collaboration website, or Cochrane if it's in the health sector. You then need to decide which are relevant. You need to get the reports and check for quality. And you then need to synthesize what these evaluations or studies say. And this is an extract from the UNICEF database, evaluation database. And you can see just for Burkina Faso, the list of evaluations that are there. It's too small for you to read, but each blue line is a different evaluation that's been done in Burkina Faso. Another possible way of doing evaluative work, it's not an evaluation, but it's an evaluative process, is evaluative workshops. And we talk about that on page 33 of the guide, and we'll be doing a training on the 28th of October. And here, you'll be doing essentially a workshop of maybe 2 or 3 days. And it's for you to reflect in an evaluative way around implementation. It could be for a diagnostic review proceeding planning, or it could even be to assess outcomes in a participatory process. And an example of a workshop purpose, and this is from a real one, which we've used in a guideline. There's a guideline that I've worked on evaluative workshops, which will be available for people doing this training. And the real purpose there was the performance of the national youth policy has been assessed and necessary steps to strengthen it have been identified. So it's an evaluative exercise. You're trying to understand performance, you're trying to understand why it's not performed and what needs to be done. So it is a genuine evaluative process, but it's not in a full process where you're collecting data from many, many data points. So the key about an evaluative workshop is it's a participatory workshop, and it allows us to critically assess policy or program performance with stakeholders. As with all good workshops, it needs to be carefully planned to ensure that the right stakeholders are there. And that may mean not just, for example, people from the center, managers from the center, but people who are handling implementation on the ground and who understand what's working and not working on the ground. It might be partners, it might be beneficiaries or clients. It needs to have a good evaluative process and it needs to be well facilitated. And you may need to contract an external facilitator to run it. You can also use it to collect data. For example, if you've got people together for 2 or 3 days, you could give them a questionnaire to fill out, so you get some more data from that way. And although face-to-face is obviously optimal, you could run it virtually. So depending on the restrictions that are in place in Angola now, you might be able to run it face-to-face or virtual. And as I say, the training on that is going to be on the 28th of October. Another option for doing evaluative work is like an annual review process, which might be a 2-week review by a team of 2 or 3 people, looking at progress against targets, looking at the theory of change, looking at reasons for good, poor or good performance, looking at lessons and recommendations. And many donors would be doing this at present. But there's no reason why government couldn't adapt this. And M&E units, for example, could be doing this for their programs, or you could have a central department which is doing some of this with some key government policies and programs. If you're doing an annual review, it really does need a report prepared well in advance, which the team validates and builds on. So as well as the time for the actual review process, it requires time for the program or policy team to develop a report against a template. And in fact, in the evaluative workshops, one of the options we talk about is where the workshop is based on an existing report as well. So in both cases, you could be using pre-prepared reports. So any questions or discussion about evaluation or about rapid evaluation? So it looks to me, Manuel, that looks like a question for people within Angola. I don't know if anybody else can answer that question from Manuel Martins.
Possivelmente o Dr. Pombal poderia responder a pergunta feita por o Sr. Manuel Martins. É uma pergunta muito útil para poder entender a participação de diferentes atores. Dr. Pombal, pode responder?
Sim, Carlos. Eu não percebi bem a pergunta do senhor. Pode repetir, faz favor?
Ok, eu não sei se o Sr. Manuel Martins pode explicar bocadinho em português a pergunta. Se não pode, eu leio aqui aquilo que foi escrito. Eu gostaria de melhor perceber como o MEP articula-se com os demais departamentos ministeriais e as ONG, no que se refere à operacionalização do Grupo de Relatório Voluntário Nacional de Angola. Essa foi a pergunta.
Ok, sim, senhora. Nós já tivemos a oportunidade no início de explicar que com a criação da plataforma é o mesmo objetivo de articularmos com todos os nossos parceiros. Portanto, cada ministério tem um ponto focal indicado que vai participar nos grupos respectivos ao seu ODS. E, ao mesmo tempo, as organizações não governamentais também estão notificadas a indicar o ponto focal para participar nestes grupos de trabalho que vamos desenvolver. É a plataforma que articula toda esta participação da sociedade civil, dos membros do governo, dos parceiros do desenvolvimento, das embaixadas, da Assembleia, da Procuradoria. É dentro da plataforma que está a articulação de todos os parceiros. Portanto, nós estamos a tentar indicar às pessoas respectivas que dela devem fazer parte e trabalharem nos grupos de trabalho que estão a ser constituídos. Não sei se fui claro na resposta à pergunta que solicitou o senhor.
Muito obrigado, Dr. Pombal. Se o Sr. Manuel gosta mais de aclaração, faz favor escrever ou dizer algo. Se não, continuamos com Ian.
Okay, so what I'm going to do, I'm going to move on to the next process, which is talking about the process from here. Let's continue with the presentation. So just to give you a feeling as to the phase from here, we had there was the initial 3-day training that Ada talked about, which was in July. Then we had a training on the 25th of August, which was on rapid evaluations. Then there's the training tomorrow, which is about synthesizing existing evaluations. And then there's a training on the 28th of October, which is about undertaking evaluative workshops. And what we do in November, December, onto May will depend on what really is most useful for the different countries. So we've only got definite plans to October, and we'll be listening to hear from you what support would be beneficial to decide what to do after October. So there is some support, which is you have the guides. For the few people, I mean, there's a smaller group that will be working with the other countries, and they will be your resource people, and those people will enable you to access to the wider support that's available. So we'll be able to provide some response to questions with answers and resources, and those will either come from UNICEF or from CLEAR. If there are particular support that's needed for particular countries, we may have a sort of follow-up remote session with you. There is a resource center which the smaller group can access. We hope that there will be peer learning that can happen, including the workshops that are being organized by UNECA. But also, as you start to participate in the training with other countries, you'll be able to share with those other countries and learn from each other. You can join the different networks, the National Evaluation Associations, AFRIA, the Africa Evidence Network, AppNode. AppNode is the Parliamentary Network on Development Evaluation. You can consider whether you want to pilot rapid or longer evaluations. And when you do this, you can also think about how you do this in a way which helps you to develop evaluation systems in country. Or you could do some rapid synthesis or evaluative workshops. One of the challenges we find is that there are often big gaps between the monitoring and evaluation units, national statistics offices, and the sections that are responsible for SDGs. There's often a divide. So one of the important things is to build the bridges between those different groups in the country. You can also consider training for researchers or government, and organizing for yourself, for example, training in evidence synthesis. And there's also a video on a very nice rapid evidence synthesis facility provided at Makerere University. I was very shocked to see that there was a big fire at Makerere University yesterday. And you could contract support from, for example, from local universities to help you with that. Ada, who's going to be speaking from your group? Anybody? Will it be you or will somebody else?
I will be the one.
Okay.
Because it was hard to get volunteers.
Fine.
So
okay, so maybe do you want to start then?
Yeah,
just give us a quick feedback.
Yes, thank you very much, Ian. Basically, the group was a very interesting group. The participants felt that they were learning and were internalizing. They were very much interested in learning about evaluation, and they are very much keen to incorporate the learnings into a very good process of developing the voluntary national reviews. There was a strong interest on how to best communicate, do the dissemination and communication of what is incorporated in the voluntary national reviews. And that was a main interest. The second interest was to learn about good practices of other countries in the development of their voluntary national reviews. And the group said that once they feel that they master a little bit the topic, they will be able to share their experiences. However, there were some technical problems of some people, and when we were asked to come back to the main room, there was a colleague that was explaining, there were two colleagues explaining about that before the ministries were working in silos, but they decided through the Ministry of Economy and Finance to create a platform to connect the different line ministries and to ensure a more coherent report. And they have already an experience that was shared in Ecuador in 2016. And they were just telling about this experience when we were asked to come back to the room. But it was a very exciting and vibrant discussion. Thank you so much.
Great. Carlos.
Yes, thank you. En nuestro grupo, okay, in English. In our group, the discussion was intensive. Yes, it was. We were very excited about the topic, and we proposed at least 3 questions. The first question was about the experience in Uganda, because you mentioned that Uganda made a very good example of national voluntary review. So we would like to know how were incorporated the studies, not the evaluation. We are talking about the studies that maybe some organizations, institutions, governmental sectors made into the national voluntary review. The second topic, the second question was about, yes, we know that it's very important to embed evaluation into the preparation of the national voluntary review, but it takes time. And as Angola, we don't have time to make specific evaluations, no, just to get some evidences. So the question is, do you think that we must use just the studies that we made in the last years to provide evidences? We are talking about, for example, DHS. We are talking about national service, etc. Because as Angola, we will not have time to do specific evaluations, just to incorporate the result of the evaluation into the national voluntary review. The last question is about the use of the evidences. Any study, can we assume that any study is going to provide evidences for us? Can we assume that any research is going to provide valid evidences? And finally, we have at least 2 main ideas that we got from this discussion. The first idea is that we need to learn more about rapid evaluation. We need to be capable to do that, because as you explained it, maybe in this way we will have more evidences, but we need to learn, and maybe this is a challenge for all of us. The second last idea is that in the African countries, we know that there were a lot of production in terms of knowledge about SDGs, about what happened in the countries, but the exchange of information is not usual, it's not a common practice. So how can we promote this kind of exchange just to learn from each other? Thank you.
Okay, just in the interest of time, because our time is up, I'm just going to respond quickly to those very, very useful questions. So Ada, there weren't so much questions as comments, so I'm going to respond rather to Carlos's. So first of all, Uganda's experience was of doing evaluation maps. They do have good monitoring and they do have good evaluation experience, but the very good VNR that I mentioned is not Uganda, it's Nigeria. So that's the one. If they can read the Nigerian one, that would really be a good one to look at. And then the point I think about the time for evaluations, that's why we're talking about rapid evaluations. So rapid evaluations or evaluative workshops or annual reviews are all possible things you can do in the time you've got. So, but first of all, it does make sense to find all the existing evaluations, because you'll probably find, even if the government hasn't done them, that donors and non-government organizations have done many. And you probably can find 50 to 100 just of those, which would be a very good evidence source to start with. So I think between assembling the evidence that exists and then doing some rapid evaluative work, there are things you can do. Just in terms of the existing studies, many of them will be research, which is important to look at. But the problem with the research is it may not explain performance of programs and policies. They tend to be more open-ended than that, and they don't necessarily have recommendations for improvement. So it's very important to try and find the evaluations if you can. I think, and then in terms of exchanges, there's, for example, there's an African network called Twende Mbele, which is a partnership of African governments on monitoring and evaluation, and that is one mechanism of exchange, and we can send you the link for that. There's also the African Evidence Network, which is having its conference this week, which is a very good mechanism of exchange. It's a bit more researcher orientated, whereas Twende Mbele is government orientated. There's also another one called AFCOP, which is about results-based monitoring. So these are all mechanisms where you can share across government, but not specifically about VNRs. It's more about evaluations and M&E. I see there's a comment from Patricia, and definitely qualitative research. So some research, particularly more action-orientated research, can give very valuable information. So it is valuable to look at the research which exists, and if it's research which provides you good explanations of why things are working or not, it's very valuable, and you need to look at it.
On behalf of the partners, UNICEF, UNECA, and Clear Anglophone Africa, I would like to thank you very, very much for your participation and engagement in this training, in this 2-hour training. I know that language is a barrier, but we are doing our best to be sensitive with that, and for that we have, as we mentioned before, and Ian has referred to throughout the training, to the VNR guidance that has been translated into Portuguese. There has been an expressed interest in this 2 hours for exchanging of experience, and Ian has kindly mentioned some sources that you can reach. But because of the language, I think you should also reach Clear and Lusophone Africa and Brazil, Clear Lab, that Carlos Javier is already in touch with, and they will be doing a 4-day training for you in early October. And I think that through Clear Lab, there is an opportunity for you to get more experiences and get more in contact with Lusophone experiences related to evaluation and hopefully to VNRs as well. As we have mentioned at the beginning, this is only one activity in the wide range of activities we are doing towards supporting countries to embed evidence in their voluntary national reviews. We will continue in close touch, and we will also be coordinating and supporting the training that will be done in October by Clear Lusophone and Lusophone Africa and Brazil. And through UNICEF Angola, we will be in touch to share more resources or to respond to your questions as you deem necessary. Thank you very, very much for your interest, your engagement, and I know the time is always a constraint, and in 2 hours we weren't able to resolve all your questions, but we hope we touched upon the most important ones, and in the 4-day training we will have more opportunities to discuss and to engage and to further develop the contents and to also to further exchange experiences. Thank you very much. Obrigada. Brigadinha.